Low back pain is one of the leading causes of disability worldwide, and lumbar disc herniation is a major contributor to this burden. But what exactly happens when a disc herniates? The intervertebral disc, which sits between the bones of your spine, can become damaged due to aging, injury, or mechanical stress. When the tough outer layer weakens, the soft inner core can bulge or even break through, pressing on nearby nerves. This can cause pain, numbness, or weakness. However, not all herniations require surgery. Many improve on their own, thanks to a fascinating process called disc resorption. Disc resorption refers to the body's ability to shrink or even completely remove herniated disc material over time. This process often leads to symptom improvement and sometimes full recovery without surgery. The phenomenon was first described in the 1980s, and since then, studies have shown that a significant number of herniated discs can partially or fully regress. But how does this happen? The body recognizes the herniated tissue as foreign, triggering a complex immune response that gradually breaks down and clears away the disc material. Inflammation is often seen as something to avoid, but in the case of disc resorption, it's actually a double-edged sword. When the disc material escapes its normal boundaries, the immune system responds by sending in cells like macrophages. These cells release enzymes and signaling molecules that help break down the herniated tissue. Interestingly, standard anti-inflammatory medications such as NSAIDs and steroids may actually slow down this process by suppressing the very inflammation needed for resorption. This paradox highlights the complexity of the body's healing mechanisms. Macrophages are the star players in disc resorption. These immune cells are recruited to the site of herniation, where they engulf and digest the disc material. They also release cytokines and enzymes called matrix metalloproteinases, which further break down the extracellular matrix of the disc. Studies have shown that herniations with more macrophage activity are more likely to regress. The presence of new blood vessels or neovascularization helps bring even more immune cells to the area, accelerating the healing process. Intervertebral disc is made up of a jelly-like center called the nucleus pulposus, surrounded by tough rings of collagen known as the annulus fibrosus. Herniations can be classified as protrusions, extrusions, or sequestrations, depending on how much the disc material has escaped. Sequestrations, where the disc fragment is completely separated, are most likely to be resorbed. The composition of the herniated tissue also matters. Those rich in nucleus pulposus are more likely to regress than those containing cartilage. Sorption is a dynamic process involving several steps. First, the herniated disc material triggers an immune response, attracting monocytes that transform into macrophages. These cells break down the disc tissue, while new blood vessels grow into the area, bringing more immune cells. Apoptosis or programmed cell death also plays a role, as dying cells are cleared away by macrophages in a process called efferocytosis. Over time, the disc fragment shrinks and symptoms often improve. Cytokines and chemokines are signaling molecules that orchestrate the immune response during disc resorption. For example, TNF-alpha and interleukin-1 beta promote inflammation and stimulate the production of enzymes that break down the disc matrix. Chemokines like MCP-1 attract more immune cells to the site. This carefully balanced signaling network determines whether inflammation leads to healing or persistent pain. Understanding these molecular players is key to developing new treatments. Vascularization, or the growth of new blood vessels, is essential for effective disc resorption. These vessels allow immune cells to access the herniated tissue, speeding up the breakdown and removal process. Alongside blood vessels, new nerve fibers may also grow into the area, a process called neoinnervation. While this can contribute to pain, it may also help regulate tissue remodeling. The balance between these processes influences whether a patient experiences relief or ongoing symptom. Not all herniated discs are equally likely to be resorbed. Factors such as the type and size of herniation, tissue composition, patient age, and lifestyle all play a role. Larger sequestered herniations with a high nucleus pulposus content are more likely to regress. Younger patients tend to have better outcomes, while smoking in older age can hinder the process. Even the presence of certain tissue types like cartilage can make resorption less likely. Lifestyle choices can impact both the risk of herniation and the likelihood of resorption. Smoking, for example, impairs blood flow and alters immune cell function, potentially delaying healing. Obesity increases mechanical stress on the spine and may affect the resorptive process through changes in blood vessel growth. Heavy physical workloads are linked to herniation risk, but their effect on resorption is less clear. Maintaining a healthy lifestyle may support the body's natural healing ability. Physical therapy is a cornerstone of conservative treatment for lumbar disc herniation. Early movement and targeted exercises can help reduce pain and improve function. While direct evidence linking physical therapy to increased resorption rates is limited, regular low-impact exercise is associated with healthier discs and better outcomes. Activities like running, tai chi, and yoga may promote disc hydration and support the healing process, making them valuable tools in recovery. Complementary therapies like acupuncture and herbal medicine are sometimes used alongside standard treatments for disc herniation. Some studies suggest that acupuncture may help modulate inflammation and improve blood flow, potentially supporting disc resorption. Herbal remedies often used in combination with other therapies have also been associated with symptom improvement. However, the evidence is still limited, and more research is needed to clarify their role in the healing process. Anti-inflammatory medications like NSAIDs and steroids are commonly prescribed for pain relief in disc herniation. However, their effect on disc resorption is controversial. Some studies suggest that suppressing inflammation too early may actually delay the natural healing process, while others show little difference. The timing, dosage, and duration of these medications likely play a role. More research is needed to determine the best approach for balancing pain relief with optimal healing. Despite advances in understanding disc resorption, many questions remain. Researchers are exploring new ways to study the process, including advanced imaging, single-cell analysis, and organ-on-chip models. The goal is to identify biomarkers that predict which patients will recover naturally and to develop therapies that enhance the body's own healing mechanisms. Personalized medicine, taking into account genetic, anatomical, and lifestyle factors, may one day allow for tailored treatment plans that maximize recovery and minimize unnecessary surgery. Lumbar disc herniation and its resorption are complex, dynamic processes involving mechanical injury, immune activation, and tissue repair. While most patients improve with conservative care, predicting who will recover remains a challenge. Understanding the cellular and molecular mechanisms behind resorption opens the door to new therapies that could harness the body's natural healing power. By integrating lifestyle changes, physical therapy, and innovative research, we can look forward to more effective, personalized treatments for back pain and disc herniation in the future.